Welcome back. Well, there is a health crisis in Canada that predates the pandemic, and in the province of BC is currently more deadly than that pandemic, even as British Columbia reopens post-COVID-19 and finds that it has done wonders with conquering that crisis. It is facing new deaths, 107 in the month of May alone, from opioid overdoses and toxicity related to illicit drugs. It's a crisis that's gaining national attention, one that even Theresa Tam has raised concerns about. Donald MacPherson is Executive Director of the Canadian Drug Policy Coalition. He joins us now. Donald, thank you for being with us. And I guess I'd like to start with the extent to which the pandemic has exacerbated the situation for this vulnerable population, because many people may not even appreciate that part of it. Already vulnerable, already issues you were working on before this began. How was it made worse in the last 3 months?
The pandemic has hit hard. We're in our 5th year of a public health emergency here in British Columbia, and the onset of the pandemic has complicated things tremendously. The closure of borders has disrupted the illegal drug market. So the drug market, the purity and the toxicity has changed, and it's become more toxic. The public health requirements to physically distance is problematic for people who are accessing the illegal drug market. Drug use is a very social activity, often sharing and purchasing sharing. So in many ways, the pandemic has really made things much worse, and that's why the numbers in March, April, and May are through the roof in British Columbia. It's 170 in deaths in BC in May. That's the highest recorded in the history of the province.
And a staggering number, obviously, a tragic number. If you could write a rule, assuming that we're learning as we go how to deal with pandemics and enforce lockdowns, what would we do differently when it comes to this segment of the population? Keeping in mind that one of the reasons we kept access to liquor stores was precisely this reason, because there's a segment of the population that would face withdrawal and medical harm if they couldn't get their booze. How do we do the same thing for people who deal in less legal products?
Well, we should be doing exactly the same thing as we have done with booze and with cannabis, I might add. We have encouraged people to, have access to the substances that they use. Unfortunately, our laws, drugs are criminalized, so we need to decriminalize these substances for possession for personal use. We need to allow people to have an access to a regulated supply of substances. The drug market, 86% of the deceased in British Columbia, illegal fentanyl was found in their system. So we've known for 8 years now that fentanyl is a growing problem. So we need to provide access to a legal regulated supply of substances. So our drug policies don't allow us to pivot quickly, as we've seen in the pandemics. With the pandemic, there's been a lot of innovation. There's been businesses have gone from making alcohol to making hand sanitizer. Just overnight, industries have retooled and changed things. We have not been able to do that because our drug policies constrain us. They restrict us from responding in a resilient type of way.
Could we create a safe supply to avoid the deaths of vulnerable people without decriminalizing? Or do those two things go hand in hand?
Well, right now we are beginning to create a safe supply. There are some innovations coming out of Health Canada and out of the province of British Columbia, and some other jurisdictions are beginning to prescribe pharmaceutical stimulants and opioids in an effort to give people an alternative to the illegal drug market. It's very small steps at the moment. It's certainly not scaled up nationally. It's not a national response. It's late in the game, but it's an example of what can be done, and we need to really scale that up. We need to decriminalize at the same time, because it's the policies that's due date is past. We have mountains of evidence that the criminalization of people who use drugs is not good for public health. And we need to bite that bullet and think differently.
The fear of decriminalization is that you entrench illegal players who do create the supply. Can you make it the opposite? I mean, that was always the conversation around cannabis, is you bring it out into the light and legal businesses take over from the illegal ones. Would that be true of some of these harder drugs that would remain very much criminal in other countries?
Absolutely, it would be true. The sky would not fall if we decriminalized possession for personal use, and the sky would not fall if we allowed people to go into a clinic and access the substance of their choice. It's just something we have to do at some point. At what point do you realize that the war on drugs has failed, and develop, with all the public health intelligence we have in this country, develop a public health oriented legal, regulated supply for people who use drugs. Drug use is not going to go away. It's been with us forever. It will be with us forever. So let's try and make it as safe as possible for those people who are using, and let's try and provide services for those people who actually develop serious addictions.
One of the big challenges, Donald, both for users who are vulnerable and find themselves in trouble, and for others who are kind of contemplating policies, is still the stigma around the people who are addicted to some of these substances. And there are many a number, and they cut across every category of society. We know this. What's, in your experience and your understanding of this, what's the best way to help reduce that stigma? And I'm thinking particularly of the addicts themselves, so that they can come out of the shadows and be a little less ashamed of where they stand.
You're absolutely right. The shame is immense. The self-deprecation, the self-worth, and the stigma is tremendous. And much of that results from 100 years of seeing that the activity of using these substances as a criminal activity. For over 100 years, we've been chasing people around our cities. And I might add, not all people, because wealthy people don't have any problem with having police chase them around, or they don't end up in jail for using their heroin or their cocaine or their methamphetamine. Our drug policies hammer away at Indigenous, Black people, people of color, poor white people, homeless people, people with mental health and addictions. Look at our prisons, the overrepresentation of people like that in our prisons on drug offenses. It's just an unjust framework. And to deal with stigma, you hear a lot about stigma, but to really deal with stigma, we've got to stop treating people like criminals. Criminalization is the biggest problem in the stigma.
You're getting at a pretty important point here, which is, as we look to places where systemic problems exist in our society, and there's a will at the moment to try to tackle them, is there a silver lining here for you, Donald, that this might actually raise this issue, that is clearly a systemic place where racism exists in our society?
It's been stunning to watch institutions, organizations like the RCMP, federal ministers, our prime minister, grudgingly come to say the words out loud. Yes, systemic racism is in Canada, is in our systems, is in our institutions. They need to come to the same place around our drug policies. They need to say the words out loud that our drug policies have been a catastrophic failure, and now is the time to rebuild our drug policies based on public health and human rights, and not criminal justice, policing, and punishment. So yes, but it's not happening. You're seeing it with systemic racism. You're seeing it with other issues. But politicians have to say it out loud that our drug policies are not working. They're causing more harm than good, and we need to rebuild. And there's lots of very intelligent people that can help us do that. We can have a world-leading drug policy if we put our minds to it.
It's great to have your time today, Donald. We appreciate it.